The pituitary gland, which is controlled by the hypothalamus, has two distinct parts, the anterior and posterior lobes. The anterior lobe is also called the adenohypophysis. It secretes 6 important hormones, including growth hormone, prolactin, and several tropic hormones. Prolactin, or the lactogenic hormone, initiates and maintains milk secretion by the mammary glands. During menstrual cycles, prolactin inhibiting factor, or PIF, inhibits the release of prolactin. As the levels of estrogens and progesterone fall during the late phase of the menstrual cycle, the secretion of PIF diminishes and the blood level of prolactin rises. Prolactin levels also rise during pregnancy, fall after delivery, and then rise again during breastfeeding.
Well, the reason I first found out about the prolactin was because in 1989, during the summer, I developed this excruciating pain in my left breast. It was like there was a knife in it. And I went to the emergency room, and they said, oh, you seem to have some kind of infection.
Yeah.
So they put me on antibiotics.
Right.
And then when I came back to New York, I went to a gynecologist, and the only thing that was available was Parladol, so she put me on that for a while, and I went off it because I didn't like it. So basically, back then it was 300.
Wow. Do they know why the prolactin was so high?
No.
Okay.
Nobody knows.
Nobody knows.
Everybody I've talked to about it has no idea.
Interesting.
A ligament is a band of tough, flexible, dense, white, fibrous connective tissue that connects bones or cartilages, serving to support and strengthen joints. Ligaments are the key stabilizing structures around the knee joint. The ACL, or anterior cruciate ligament, receives the most attention. It courses from the posterior area of lateral femoral notch to the anterior tibial spine by passing by the PCL, which runs in the opposite direction. The ACL keeps the tibia from moving anterior or frontwards relative to the femur. It also controls a component of rotation. This is the ligament that is typically injured when a knee is blown out.
It is an unfortunate truth that inadequate and inappropriate surgery is performed every day in this country. In just 1 year, surgeons have operated on the wrong eye, the wrong leg, the wrong side of the brain, and even the wrong patient. Although it's true that such inexcusable incidents are rare, the fact remains that they do happen, and they could happen to you.
The knee was irrigated out well with normal saline, as were the wounds. The iliotibial band was closed with vicryl sutures. Skin was closed in running subcuticular Prolene and reinforced with Steri-strips. The patient was then placed in a knee extension brace and brought to the recovery room in good condition.
Sex is a way of reinforcing intimacy. When our sexuality is healthy, we often fail to notice how important it is. But when things aren't going well, bad sex may rule our relationship and indeed cause its demise. Sexual problems are a major reason for divorce, but the chicken and egg question is, which came first, a bad relationship or bad sex? Even in what the statisticians would call normal marriages, couples find that sex is disappointing or a downright failure 5 to 10% of the time. That doesn't mean the marriage is doomed, but there is a point when it's appropriate to begin to worry. If you are having problems and they seem more frequent or persistent than in the past, don't ignore them. Consider going over the next set of questions with your physician. A sexual health checklist.